My chosen topic is suicide. Suicide is the intentional killing of oneself, with unsuccessful attempts being considered attempted suicide. Suicide is the 8th leading cause of death for Americans. The most striking thing about those who commit suicide or attempt it is that 90% of them have a serious but treatable mental illness. Now, when we talk about mental illness, there's a stigmatization that goes along with it. There are thoughts that the person who is mentally ill must just be crazy or that they are immoral for thinking about suicide, much less going through with it. Two experts in the field of suicidology I would like to introduce are Dr. Ronald Maris, who is a certified forensic suicidologist. He works as an adjunct professor in psychology and family medicine and has authored 2 books about suicide. Then I have Dr. John Mann. He is a director of neurochemistry and he is a professional in translational neuroscience. He is vice chair for Columbia University Psychology Department for Research in Molecular Imaging. Dr. Maris is an expert in the field of suicidology who investigates suicides, risk factors, the events leading up to suicide, and examines the brain after suicide has been committed by performing a psychological autopsy. Psychological autopsies are done by examining the brain of the deceased and asking friends and family members about the events surrounding the suicide. Maris and other experts question the validity of the research by recognizing the flaws in psychological autopsies. It is their assertion that researching using psychological autopsies may be faulty because the findings cannot be confirmed by the person who is being studied. Maris recommends the American Association of Suicidology for further information about suicide. Dr. John Mann is trained in psychiatry, internal medicine, and neurochemistry. He has conducted research into brain imaging in an effort to try and find the causes for depression that lead to suicide. He is also in the midst of exciting new research for a new drug treatment, ketamine, that treats the underlying psychological issues that could lead to suicide. A website Dr. Mann would suggest is the Brain and Behavioral Research Foundation. When comparing the two doctors, it is clear that both are experts in the causes of suicide, but the way they research it, it's done quite differently. Dr. Maris prefers to study the individual after death, and Dr. Mann does the research on the living brain. They both realize there is a brain dysfunction, but Maris studies it by performing psychological autopsies, and Dr. Mann does it by studying the brain of one who is still alive. Both doctors agree that the underlying mental issues associated with suicide are treatable. Elders commit suicide at a rate that is beyond comparison to any other demographic. Most elder suicide is committed by those with major depression, and the depression could stem from losing a spouse, financial insecurity, or being isolated from society. Nearly all mental disorders increase suicide risks. Major depression is the biggest culprit, but genetics, family history, hopelessness, and bereavement also play roles in how the brain develops dysregulation. Psychological autopsies have confirmed these associations.